Sorry.
Good morning. My name is Eric Monagle. I'm a student physical therapist assistant. I'm going to be talking to you about amyotrophic lateral sclerosis, which some of you might know because of that ice bucket challenge. You know, things going on this year. So what is it? This is just a brief overview before I get into some of the details. It's also known as Lou Gehrig's disease. He was a pretty good baseball player on the Yankees. Diagnosed in 1939, I believe it was on his birthday. So it's not good. Another person by the name of Stephen Hawking was diagnosed in 1963. He's still living, which is pretty amazing. I'm about to tell you why in a little bit. It's a nervous system disease affecting both the upper motor neurons and lower motor neurons, or individually. It can be very stressful on them. You know, just picture yourself, your arm falling asleep one day and you can't move it or something. It's just little things that happen first, and it can be very stressful just because it doesn't affect the brain. You know, it just affects your upper motor neurons, your lower motor neurons, or both of them, not your brain. It's also progressive, meaning it starts at a very small level, it'll get worse eventually, and disable the body in one way or another. It's also fatal. So I think it's good to start with the nervous system, just to get a basic overview. It's going to originate from the motor region of cerebral cortex, which controls the muscles of the body. This system is going to pass down a neurotransmitter called glutamate, which helps it travel quicker to the lower motor neurons to help control. Lower motor neurons they innervate into the muscle belly, which helps the muscle move. So in short, the upper motor neurons are going to have a synapse with the lower motor neurons, while the lower motor neurons have synapses with the muscle itself to help carry out this movement. So this is the pathology. It's a progressive neurological disease. Like I was saying, it affects upper neurons, upper motor neurons, lower motor neurons, or both. Motor signals from the brain to the muscle fibers are going to be disrupted, and it's going to have it's a slow but progressive loss of activity, which is going to cause atrophy, muscle weakness, fatigue. Like I was saying before, motor neurons are going to be affected, which is you're losing control of the muscles. This is basically tearing apart the word amyotrophic lateral sclerosis. It means no muscle nourishment, which I didn't know before. So, signs and symptoms. Be weak in a particular area. You'll go to pick up a pen, or you'll go to walk up the steps. You'll notice it's a little bit harder than it was at first. That's why it's pretty frustrating. The normal things you'll be doing, it's going to be a little bit harder. As long as you walk, as we were doing earlier, you'll notice the heel drop, you'll be wear and tear on your certain shoe, not on the other shoe, because your foot's dragging. So you'll be slapping, you won't have control of that muscle. Slight difference in speech, which your family might pick up on first. Be like, what are you doing talking on the phone? You sound a little different. Like, I don't know. Or something, you start sounding different. So you're going to also be clearing your throat a little more often. Like, it's progressive. And it's painless. It's painless, progressive. So like I was saying about your arm falling asleep, you're not going to it doesn't hurt. It's just going to be a real annoying type of, you're just losing normal muscle function, which leads to muscle wasting and atrophy. It's going to be later stages of ALS. It's going to be extremely difficult, like talking, breathing, doing anything. You're going to need a lot of assistance later on in later stages. Swallowing also, that's going to be difficult. also, as this disease progresses, I feel like it will affect you mentally and physically. Mentally, because you're going to be going through all 5 stages of depression. You're going to be going through a lot mentally through each stage. You're just going to be getting worn down. It's all about how you handle yourself as a person, how you get through this. And I'm going to be going over some of the physical stuff and how it progresses right here. I figured I would start with early stages and then implicate it as with physical therapy as I go through it. So they're going to be taught on how to use wheelchairs early to prepare for their future activities for their daily life. And the physical therapist will teach them how to use the equipment to support their muscles and also improve their safety and mobility as they move forward. Just to give them a heads up, listen, this is what might happen moving forward, and we're going to train you before the worst of the worst happens. Heaviness and fatigue when holding their head up, that's going to start happening. They're going to benefit from a soft collar, also a wheelchair, may be necessary for long distance travel. Extreme muscle fatigue will follow a great decrease in general mobility. So the physical therapist will perform treatment on those who are unable to perform daily tasks, including transfers, pain management, skin care management, range of motion, and communicating to the patients regarding their plan of care moving forward. So this is more of this is why physical therapy is important, because let me just keep moving forward. I don't want to confuse you guys. Later stages, they're going to have a max assist through the entire day. The physical therapist is going to utilize many postural positions to help with their lung and heart health. Also, there's going to be a massive decline in respiratory health, which is usually the result in death, pneumonia, or atelectasis, I believe is what how you pronounce it. It's a collapse of one or more areas of the lung. Not good. Also, tracheostomy. I put a question mark because you want to ask them, is this something you want to do? Is this something you want to really try and work on? A lot of people are going to be like, no, I don't want that. It's just a breathing tube, pretty much. You want to talk to them about it, so you're not going to be able to talk. You're going to have to use, I don't know, you heard Stephen talking, he's got that little thing programmed. So that might be frustrating for some people. Like, no, I don't want to do that. I don't want to do this. I don't want to do that. So just some things moving forward in the future they have to ask them about before it gets worse. Aspiration, weight loss, pressure sores are also going to be a complication. This is where it got conflicting with physical therapy because of the disease itself. It could increase the risk for muscle wasting of that valuable muscle they have. That's the only muscle they have left. Doing these excruciating workouts, good for them. I don't know. I don't believe so. If the ALS patient is not active, however, it can cause the same effect of the disease itself in a way, in a sense, because you're not using the muscle along with the disease. So now where are you at? You're getting worse. You're still getting worse. So that's where the complications occur. Just going back a couple PowerPoints ago, I believe it's good just to have the PT there guiding you through your ADLs, making sure you have a better quality of life day by day. I'm not saying it's going to be the best quality of life. Like I was saying, it's maintaining the best quality at a particular time. So as you get worse, they just need to do the best they can at that time. By using airway clearance, they educate them on what's going on, give them mood modifications. They stretch them out, make sure they get the range of motion, try and help them out with body positions and cardiopulmonary techniques, also pain management. They should also be educated about this disease because you're working out a person with ALS, and if you don't know that overuse is going to tire them out and make it worse, you're not doing them any good. It can be pretty harmful to them. The causes for ALS, they don't know a definite cause, but these are possible causes. I strongly believe it might be, or it is environmental. but there are some cases that think it's physical activity, chemical exposures, trauma, military service, which is a big one also, infectious agents, occupation and occupation exposures. This was pretty cool, not cool, but interesting. Possible glutamate excitotoxicity. What is that? That's what I first thought of when I saw that. It's caused by increased levels of increased plasma levels. All right. There's a lot of glutamate building up. How it passes down from the motor cortex, that neurotransmitter glutamate. It's going to be a big buildup of glutamate and decreased uptake. So around that synapse, moving down the chain, it gets built up because of the. Actually, I can add a picture. Yeah, here it is. So that size, the normal one, the astrocyte, which is that purple cell, is supposed to be taking in the glutamate and helping, also leaving a little bounce there to help the nerve fire quicker, faster. That's what glutamate does. Helps it out. This ALS affected patient, they believe the astrocyte is going to have these the receptors, it inhibits that intake of glutamate into this cell. So it builds up in the synapse, which triggers a constant action, like go, go, go. You're going to get worn out eventually. That's going to die out. And that's what they believe it is. That's what some believe it's caused by. Because certain studies have tested people with it, and all their glutamate levels are up. They don't know. It's a good thing to look into, I believe, at least. So, ribosol would be a good treatment for that because it acts as a buffer for that glutamate. And that's why, well, Rilotech, they'll give people this Rilotech and baclofen for spasticity. Trihex. This word right here is for people that are having problems swallowing. Also physical therapy to help maintain that quality of life. It's also, I believe it's hard for them to find a cure because they don't know what causes it. They don't know, so no genetics, environmental, the glutamate, they don't know. So these are just some charts that I have, which it's the prevalence rates, which these numbers they could be better. It says it's more prevalent in white people, but again, the numbers are around 10,000. They tested 10,000 people as opposed to 798. Also, that was up there. 60. It's more prevalent in 70 to 79-year-olds as opposed to it's more when you get older, you'll start noticing this. It's not necessarily when you're younger, but again, they could have tested a little bit more people to maybe had better results. But these were the deaths. 3-year survival rate for ALS. It's typical to diagnose people 3 to 5. I believe that's what they said. 50% will live 3 years after that, according to the Johns Hopkins Hospital. 5-year survival rate, only 20% will live past 5 years. That's why I believe it affects you mentally. The doctor's going to be like, listen, you got so many years left, so not just somebody coming up to you and saying that. Start planning stuff out, whether you got family or not. Get pretty crazy. 10-year survival rate, only 10 people. That's why I believe it's pretty crazy for Stephen Hawking to be living. He got diagnosed in the 60s. He's still here. He's been doing everything he can to challenge this disease, using his little wheelchair. Now he's losing muscle control in his hands, so it's pretty crazy story. There's a movie on him if you want to watch it, but just watch that. 3 to 5 years is the mean survival of people with ALS. And I believe we should, I think it was cool last year how they did the ice bucket to get awareness. I didn't want to focus this presentation specifically on the ice bucket because everybody knows that. Just for awareness. We need awareness guess we need to have people figuring out what this is, because it's would affect a lot of people. In fact, any one of us they don't know why it happens. They don't know any cures yet. So just need a lot of research moving forward. These are my resources. I don't know if you have any questions. I can answer them.